Medicine at the Morsani College of Medicine at University of South Florida. And I also have a joint appointment in the College of Public Health, also at USF. I'm delighted to introduce our guest speaker today, Dr. Fernando Spilki. He is a leader in Brazilian virology research, a veterinarian. He's also the pro-rector of research, postgraduate and extension programs, an expert in viral sequencing, molecular epidemiology, and has been a leader in understanding the molecular epidemiology of SARS-CoV in Brazil. And we are really, really excited to have him talk about his work in Brazil, and also look forward to discussing further with him where he thinks the COVID pandemic will go and how we as citizens of the world will continue to combat this devastating pandemic. Dr. Spilki, we're delighted to have you.
Hi all, thank you very much, Dr. Kim, and I wish to tell you about my appreciation to be here. Thank you very much to Jesse and everybody at the USF for this invitation. It is very nice for us to share some of the things that we have done in Brazil in terms of genomic surveillance of SARS-CoV-2 and all that stuff.
I'm sorry to interrupt. I realize that I forgot to say something very important. This presentation is being recorded and also going out on a live feed. So everybody attending should recognize that this is being recorded. In addition, we have an international audience, so questions can be typed in at the end of the presentation in English, Portuguese, or Spanish. And this is where we're very fortunate that Dr. Spilki has talent and fluency in multiple languages. So we look forward to having an international discussion at the end of the presentation. Thank you. Sorry for for interrupting.
No, thank you very much. That these are very, very important some issues that we have to address. It's actually, this will be my pleasure to answer questions if you have any of those at the end of the presentation. Well, the thing is that, you know, as you may have read in the news or even in scientific reports, Brazil was a very important place in terms of the pandemics. Actually, we have suffered a lot with the COVID-19 pandemic. We are the country in the world with the highest number of deaths when related to the size of the population and all that. So we have some special features here in our pandemics that could be a model or a matter of study for older countries. Well, this slide is here to start my presentation because this particular paper always comes to my mind because of personal memories. At the time that I was reading this paper, at the very beginning of February 2020, I received a call from people at the Ministry of Science and Technology in Brazil. At the time, I was the head of the Brazilian Society for Virology, and they were asking me whether we should or should not have some sort of meeting to start some sort of collaboration, and maybe virologists in Brazil could be or not prepared to discuss about this virus that was happening in Wuhan. And the thing is that at that very time, we are not so worried as we were in the coming weeks that followed. But we went to Brasilia, the national capital of Brazil, and we have a fruitful meeting in which we have elected some priorities for the tackling of a pandemic if this took place, but it was only theory at that time. And one of the priorities was, of course, vaccines, The other priority that we have elected was about to raise the capacity of diagnosis in Brazil, of molecular diagnosis mainly. And among other topics, we have elected genomic surveillance as one of the possible needs that Brazil could have to combat a possible pandemics at that time. And soon after that meeting, the situation becomes very nasty. As you know, the situation in France or Italy or even the United States was telling us that something very big was about to come. And then we started the preparations in Brazil. And then we set up this network of the Brazilian universities for genomic surveillance. The thing is that it's not the only network in Brazil to work with genomic surveillance. From the side of the Ministry of Science and Technology, we have this network that is called Corona-Omica or Corona-Omics. And that is the network that I coordinate. And we, at the beginning of the network, we united 12 different universities and centers for research in Brazil, but there are also other networks. And one of the networks that collaborates a lot with us was the network from Fiocruz, from the Ministry of Health. And then we started to work at the beginning of 2020, and we established a website, and we started to do some sequence. But during 2020, our sequencing efforts were not that high because the money wasn't there. We are asking for money, and starting to run these programs in Brazil is kind of difficult because we do not have this continuity. The funding for Brazilian research is not always the same. So it's kind of difficult to start this sort of efforts. But we started in 2020, as well as other networks have started at the very beginning of the pandemics. And then we jumped to a much more consistent effort during the year of 2021 and 2022. And that's the history that I will tell you in this seminar. Nowadays, this network continues to work. And we have now some sort of permanent funding. That's very good because we are not working only with SARS-CoV-2. We have also eyes for other diseases. What are the goals of this network? Well, of course, our main goal is to do sequencing surveillance, genomic surveillance, and we try to gather this genomic data with epidemiological data, and we try to understand whether the vaccines are still working against variants, for example. We do a lot of research also to understand what are the possibilities of chains of transmission and how this virus does spread, not only in terms of the human side, but also whether this virus is spreading to other animal species in Brazil. Let's say that work is very complete in what regards to not only to find what are the genomes that we are finding, but whether the viruses that are there within these variants and subvariants could have any features that could hamper in the future our efforts in terms of vaccination, and also about the epidemiology of the disease in Brazil in the long term. And we have not only the goal to share these findings with the scientific community, but we do also a lot of efforts to communicate the major findings that we have to the health authorities in Brazil. So every single new variant or subvariant that we detect in our network, this is immediately we send this information to the Ministry of Health, as well as we do reports to the media, and we have also a participation in other channels like the social networks, and everything is set to be as most transparent as it could be for the society. And well, how things have behaved in Brazil in terms of the diversity of SARS-CoV-2. I could tell you that at the very beginning of the pandemics, we have received actually dozens of different variants come from other countries at the very beginning of 2020. But during the first year, two of these lineages, namely B1128, B1133, and another minor lineage like B1191 were here. And actually Brazil was giving rise to our own lineages until the end of 2020. The vast majority of the viruses that were circulating in Brazil were not imported at that time. They were not coming from other countries. And this was very interesting to see that during the first half of the year, the amount of diversity that we saw was not that high. The virus was actually very, very similar among the lineages that we were found. But at the end of the year, something very nasty started. The virus become more diverse. And then we have, as in other countries of the world, the dawn of a new horizon in terms of the pandemics, which was regulated and related to the new variants. And then this totally changed the landscape of the pandemics in Brazil. That was followed by a renovated effort of sequencing that started at the beginning of 2021. Actually, as I said to you before, during 2020, we were fighting to have the resources to do genomic surveillance properly, and actually Brazil was sequencing too few genomes per month. But during 2021, actually, to respond to the rising in the number of the cases and the new variants that come from the virus in our country, and soon after the viruses that were imported over time when Brazil opened his frontiers to other countries, then we had the opportunity, because we had the money, to do a genomic surveillance that was, I would say, quite good in terms of numbers and in terms of quality over time from the beginning of 2021 and on. And then, of course, SARS-CoV-2 is already in the landscape. The virus will be with us, I believe, at least for the next few years. But we are also not only seeing at SARS-CoV-2, I could tell you that this network is working also with a lot of other viruses. As you know, arboviruses are a real huge problem in Brazil, but we have also monkeypox, arenaviruses, and many other epidemics here. So we are also working with these viruses over time. Well, SARS-CoV-2 is by many reasons, but especially because of the complex of its polymerase, and not very prone to variation. But when you have stochastic factors and epidemiological factors that could drive even a virus that is not so prone to become diverse, but when he has the chance to infect many people, like happened in the end of 2020, what will happen is that the virus will present some sort of diversification. Even though the virus has this error correction modules within his polymerase, RNA polymerase complex, unfortunately, this is something that go by chance. And then if you have many cases, you have some degree of diversity. And that was why at the end of 2020, not only in Brazil, but on the rest of the world, so many new variants, especially the variants of concern, have happened. You have both some critical situations, some of them like the one that brought us the Gamma variant that I will tell you later in my presentation, which was the presence of some degree of previous immunity caused by previous infection at that time, could be one of the driving forces to generate variation, but you could also have the type of human behavior that we had at the end of 2020. People were really tired to be at home at that time. Many parties and possibilities to get together started in many countries at that time. The trips were allowed from November and December of 2020. It started, and then we have the dissemination, the rising and the dissemination of some of these new variants. And as you know, during 2021, we have the appearance of Delta, and soon after, at the end of the year, this new virus, this new, totally new sort of type of SARS-CoV-2 that we have found, which was Omicron, that is dominating the landscape right now. Well, during 2021, every time that we look for any viruses that were there in the field in Brazil, they will follow within maybe 2 or 3 of the lineages. They were B1.20, B1133 or B1128. And the thing is that the lineages that come after this are actually related to these lineages from 2020. But as I said, the things become a little more complicated at the end of 2020. And 2 lineages appeared. The first lineage that appeared was actually P.2, which was called at a certain point the Zeta variant under investigation. That variant was not very virulent in terms of the cases or the clinical signs that it provoked, but it was very transmissible. But at the same time that P2 was there, something very, very nasty was lurking, and that was P1, which was later called the variant of concern Gamma. That was a huge and terrible killer. That variant started its path in Manaus, the capital of the Amazon, in the middle of the Amazon watershed. The city is huge. People are mostly very poor. They were fighting for survival. And there, at the end of 2020, actually, there were no restriction measures in place. At least beginning in October, let's say, the city was functioning as no pandemics was there. And the thing is that more than 50% of people in Manaus had already had contact with the virus during the first months of 2020. At the end of the year, the number of the internships and deaths started to rise exponentially. The city was in a terrible situation. At that time, the efforts to look whether it was related to some new variant started. And at the very beginning of January, people from our team, from the team of the network of Fiocruz, and also people that have researchers that have received samples from Japanese people that have traveled to Manaus during the 2020, December of 2020, found that nasty new variant that was soon after genotyped and named P1, and then after called recognized as a variant of concern. So at the time that the rest of the world was really concerned about the alpha variant, we were seeing the first and terrible effects of P1, of gamma. And the virus started to spread slowly to other places. We at that time had the landscape dominated by P2, and we were quite worried about the number of cases that this variant was inducing. But at least it was, like I said before, it was not very lethal. And that was the situation from January until the beginning of February in most of the Brazilian states. We have P2 here. We started to see a lot of co-infections because P2 started to circulate together with B1, B1.1, 28, 23, and also B1, 91. And that was what was worrying us, whether we were going to find any recombinants from these recombinations, from these co-infections, and that was in place. A lot of cases, but a very low number of deaths. People started to be vaccinated very slowly at the time, and we were seeing this horizon in front of us. But at the beginning of 2001, February 2001, gamma started to spread violently over the country, and the situation got much worse. People were not vaccinated. Less than 20% of elderly in Brazil have received the second dose. At that time, it was the levels of vaccination were very, very low. Gamma was inducing a lot of deaths. I would say that from the almost 700,000 deaths that we had in Brazil from the beginning of the pandemics until now, something like 60 to 7% of these deaths were caused by gamma. The first semester of 2021 in Brazil were terrible. People were dying every day in numbers as high as 5,000, 4,000 to 5,000 deaths. Countings were the normal place during February, March, and April of 2021. It was awful. And then we have this worry about the introduction of Delta, but Gamma was very strong, and it started to generate lineages, sublineages. And together with Gamma, we had the start of the introduction of Delta, but it was very slow in the case of Brazil. And it coupled with the start of, at the middle of June, with the start of a more consistent vaccination program. And when Delta actually came, the wave of Gamma was passing, and we started to vaccinate better. So it was very interesting to see that even older lineages like that, this one that come from Argentina, a new lineage that derived from B1 1128, were able to take some place, but we are not seeing, fortunately, that amount of deaths and people who are not needing hospitalization and all that. And Delta started its pathway in Brazil. And that was what took in place during the second semester of 2021. The number of cases were still high, but the number of hospitalizations and deaths were not actually high. Fortunately, the situation was much more calm than in the first half of the year. And then we started to see in both Brazil and Latin America that Delta started to put some new sublineages, and specifically AY99 and AY101 were the lineages that were dominating the landscape in Brazil during the second semester, with a very low numbers of hospitalizations, very low numbers of deaths, but the number of cases were high. Despite of these numbers, people started to be more on the streets. The schools and universities have come back with their in-person classes, and well, things were actually coming to somehow some sort of normality at that time. And then Omicron came, and I'll talk about that a little later. During that time, we did a lot of studies on what was the capability of Brazil to generate new lineages, and it was awful. The thing is that we have generated hundreds of new lineages between the beginning of 2021 and the middle of the year. Much more than other countries. Actually, Brazil, India, and South Africa have this terrible mark that we were very talented during that month to generate new lineages. And at that time, we had also the opportunity to show that not only air transportation was important in Brazil to spread these new lineages, but also as Brazil relies much of his transportation, not only thinking about goods, but also thinking about people. Actually, we rely a lot on the road transportation in our country, and that was, together with air transportation, an important source in terms of the spread of these variants over the territory. And I would say that it was incredible to see this data. Road transportation hubs in Brazil, like the one that we have in the state of Tocantins, that connects the Amazon and the northeastern part of Brazil to the southern and southeastern municipalities and the metropolis in the country, were very important in the spread of both the gamma sublineages and the delta sublineages at that time. We also saw a lot of older new variants that at some point come as a worry, and we have mapped where they were being circulating, like this P4. This variant scared us because it was fighting very strongly with gamma, but at the end, fortunately, it did not spread so much as the vaccination started to reinforce. And one of the questions that always comes to our minds and health authorities was why we had this very soft Delta wave. And some people, like me at the very beginning, thought that it was related with the size of the gamma wave. the number of the people that got infected with gamma. And then, on the other hand, it could be related maybe to vaccination. And then we tested it. And this is not the only paper that showed that, but I participate on this, so I'm showing this data. And the thing is that gamma was not very immunogenic in the end. It doesn't give during the natural infection a very high levels of protective or neutralizing antibodies against Delta or other variants. And in the end, what really seems to have protected resilience from the Delta wave was the vaccine that we have used during the first semester of 2021. Of course, one of the things that we do a lot in our network is to test whether these variants are being neutralized by the vaccines that we used in Brazil. Of course, one person, I have to say this, one person could have not that high amount of neutralizing antibodies, but could be clinically protected, of course. But for us virologists, it's important to check whether these neutralizing antibodies are there and whether they could neutralize these variants, at least in vitro, because this could relate with the possibility of immune escape in real life scenarios and about the transmissibility of these new variants in vaccinated populations. And one of the findings that we had that was published in Lancet Microbes was that, unfortunately, gamma variant was not very well neutralized by the first vaccines that we have used in Brazil. So this is another explanation for the size of the problem that we had with gamma. The vaccines actually protected against severe illness, not only by gamma, but also by alpha, instead of the fact that sometimes the level of neutralizing antibodies were not that high, at least for alpha, for the alpha variant of concern. We saw that in more than one event here in Brazil. But we will not stop to look at these possibilities, because sometimes, at least in other species, we saw in the past that for some coronavirus could escape from the vaccine effort. So that's why we are studying this. And that's why exactly why bivalent vaccines come this year into many countries, because of the immune escape that was found with Omicron. And these are not in use in Brazil until now, but we believe that at least for the next year, we'll have this in place. Let me show you, I'll pass this slide because I think that we have to go to this. The thing is that Omicron have dominated this year of 2002 in Brazil. Omicron and its sublineages have totally displaced Delta by the beginning of the year in Brazil. In less than 3 weeks, Omicron have displaced Delta. Delta simply vanished from our landscape during the month of January of this year of 2022. And it was very interesting for us because during the transition between Gamma and Delta, it lasted more than 5 months to Delta to totally substitute Gamma. So that reinforces what Omicron represents in terms of its power to spread among people, fortunately not causing severe disease in most of the time. And we are monitoring this. Another thing that worries us in Brazil, going for the finish of my presentation, is about the long COVID. we are seeing a lot of long COVID cases. This is something that we started to look in Brazil. And another priority for our research is about the infections that could come and new viruses maybe that could come from people that have these primary immunodeficiencies. And we know that sometimes the clinical features in these infections of this type of persons could be from both totally benign to that. So we have to take care of them. Of course, we have to be quite worried about the possibilities of the vaccination, and actually, fortunately, boosters are helping those people also to be protected against disease. And there are a number of studies showing this. But of course, from the virology point of view, we have to have a look on these cases of prolonged infections, because these could be related to the generation of new variants that could escape the immunity given by the vaccines. And we are studying a lot of these cases here in Brazil. This is one study that we are about to publish about one boy that is giving positive results of PCR for more than 1 year. And the virus is actually there, infectious. And we did sequencing of many of the samplings that we did in him. And the finding is that the virus is microevoluting intrahost. So this is actually something that we have to take care to treat humanely these people, to give them all the possibilities for them to recover from these infections. But we have also to have a very cautious look about the viruses that could be generating these during these prolonged infections. And there are possibilities to treat them. This is one work that we have published this year about the treatment of a person that has this NF-kappa beta deficiency, and she was treated by hyperimmune rescue. That's amazing. There are other cases with other possibilities to avoid this the continuity of these prolonged infections in immune-suppressed people, and we are testing this a lot here. Well, the future landscape is of some sort of concern, because we have this XBB and BK11 new variants that are there in the United States and Europe and in Asia. We did not find these viruses yet in Brazil, but maybe they will come. Eventually they will come, and we'll have to look whether these will induce new waves or not. Let's see what happens in the future. That will be part of our work in the next months. And as I know that maybe Ricardo Zurieta is here, and I think that he will be very curious about these results. I'm showing a paper that was published by our network at the beginning of this week. That is another branch of our work that is being done. It's about the environmental surveillance of SARS-CoV-2 in terms of that this could be a very interesting tool to check whether in the post-pandemic time, if the virus could be found in sewage samples. This could be an early warning about the circulation of the virus in the population. In this work, we have found that 5 days before the start of a new outbreak, we could find the RNA of the virus in the sewage system. So this is something that could be very useful in the next few years, let's say. Our work is supported by many Brazilian agencies and also from the European Commission, and we have also many bonds with other countries especially in Latin America, but also with European partners and also South African and Asian partners as well. I have to thank you all, and I will put myself here available for the questions that could come from the Q&A.
Thank you very much, Dr. Spilki. Dr. Kim will be right on just a moment.
Sorry, my computer was refusing to unmute or add me to video. Thank you very much. I'm going to see if anybody has any questions. I didn't see any. So this is very interesting, data that you've presented, and it shows how in different countries, even though we all got, COVID and different surges and things like that, what happened in Brazil was, different in many ways to what happened in the US. For example, for us, Delta was absolutely horrible. The first wave in the United States in the spring of 2020, here in Florida, we got very little, but Delta was devastating, many deaths, a lot of hospitalizations and things like that. And Brazil was relatively spared. And our analysis for Delta, it was predominantly the people who were not vaccinated who were particularly affected. So right now, what's going on in Brazil as far as vaccination? Because here in the US, there are many people who got vaccinated, but the uptake of the boosters is not very good. And of course, we are about to go into our winter months. So what's going on with, and then obviously there's conflicting messages from the political leaders of, your country, just as there is, in our country. So what's going on as far as vaccination, and what's the public, we also are I'm over COVID, but what are people doing as far as to protect themselves as far as vaccination?
Well,
and what do you have actually? Because it's also a little bit different as far as which vaccines you have accessible to you as well.
Yeah. At the very beginning, we have vaccinated a lot with Sinovac, which is a whole inactivated virus formulation, but we have also Oxford Shadox AstraZeneca vaccine here. Janssen was here for some time. It is now used only in boosters, but we have also Pfizer being used, especially for boosters and for the vaccination of people that have some sort of higher level of susceptibility to the virus. But basically, what we are using right now is AstraZeneca and Pfizer.
Mm-hmm.
Our worry is that the rates of vaccination are actually good when you think about first and second dose.
Mm-hmm.
The booster, the fourth booster, the third dose is actually the rates are something. I believe that they are now something like 70% of the population, but the fourth booster, people just avoid it. People are not worried about that anymore. From July and on, the levels of the number of cases really dropped, and then people are not really concerned about the possibilities that a new wave could come. Mm-hmm. And that's our worry. Many of the people that are actually in danger did not come back to the hospitals to get vaccinated after July, let's say. And as we know, many of these people could be susceptible right now because they were vaccinated, let's say in January, or got busted in February, let's say. So the levels of immunity could not be that high. especially considering that these Omicron sublineages and recombinants are escaping from the vaccine immunity, at least partially. So we are a little worried about that. And the other thing is that in Brazil, the springtime, both in 2020 and 2021, was as calm in terms of the number of cases to what we are seeing right now. But if the virus have the same seasonality that it presented in the last years, the number of cases starts to rise in December, may start to rise in December, like it happened in 2000 years before, in the 2 years before. So it could happen that maybe we could find with another new wave in the coming months. I don't believe actually that will have the number of deaths that we had in the past, but of course, some people will get severe disease, and that's worrying.
Mm-hmm. So Dr. Menezes has a question about why gamma was such a problem in Brazil, but then it sort of died out. I mean, we were, especially since we're so close to South America, we were all very, very concerned, and it didn't become a problem here. Obviously, Delta was terrible. So do you think you have, I mean, obviously we don't know, but what do you think, why do you think gamma died out? And it was obviously very devastating in your country. And is there anything that you can, from that information, that you might be able to extrapolate to do things better for the next variant that comes along?
You know that this interplay between the variants that were occurring at the same time worldwide, it's something very interesting. Why Delta was so harsh, so disseminated, and also so serious in the northern hemisphere, and at that very time, why Gamma was the dominant variant all over Latin America. Actually, in South America, Gamma dominated the whole landscape, and it was only displaced by Delta months later. But in Colombia, for example, the new variant displaced Gamma. This interplay is not easy to understand. Actually, these neutralization assays could tell us something about that, but it's quite interesting to see that you have Alpha, and after this you have Delta in the United States, and Gamma did not have a chance to be with you. This is something that many groups, and even our network, is working with archived SERA to understand what what was the situation, why Gamma had not the ability to be there, and why Delta was not so prominent here. But the thing is that both one of the things that we actually have hypothesized is that Gamma and Alpha were quite similar in many aspects, both in virulence and many of the epitopes that were there. Maybe the interplay between them was one that will make they really fight for the hosts, and one will not take place that the order was in which the order was the prominent. That, on the contrary, Alpha was, the number of Alpha cases were very, very, very low here, maybe because of it. Gamma totally avoided it generating antibodies that neutralized Alpha, maybe.
Okay,
but
so maybe
that's a difficult and very interesting question.
Yeah, and so then so you're thinking that the combination. So do you think vaccines were more important? Because you said initially you thought maybe it was gamma crowding delta out, but that obviously for vaccines, also you rolled out the same time. And in our case, it was pretty clear that if we hadn't had the vaccine, as horrible as delta was, it would have been even worse. It would have been like what you saw with gamma if we had not had vaccines. It was like the really sick people. They were people either who, most of them were unvaccinated, and the few who were vaccinated were people who had almost no antibody response because they were immunocompromised. So they tried to be vaccinated, but they didn't generate a response. So how do you think those two things interplayed in your country?
Well, from the data that we have, the objective response is that the vaccines were much more important than the natural infection during the transition of gamma to delta. Was proven in many studies. But nowadays, we are seeing that hybrid immunity could be very important. Actually, we're seeing that in the places in which gamma circulated a lot, and then people started to vaccinate as a response to it, the number of cases and the severity of cases caused by Omicron are much lower. So we really think that hybrid immunization could be important, especially against Omicron, because nowadays what we are seeing is that the number of reinfections, Omicron reinfections, are getting lower over time in people that were vaccinated and had the disease. So it seems that in the present scenario, different from the past, hybrid immunization is very important, because at the very beginning of the Omicron outbreak, the number of reinfections were high, enormously high. At least 30% of all cases that our laboratories have diagnosed during the first semester of 2022 were reinfections, and caused by very close Omicron sublineages. So, and when you see when you look at the data, at least half of these cases were in people that were not vaccinated or had only 1 or 2 shots. So it seems that you have to be vaccinated first. And then if you have another infection with Omicron, okay, maybe you will be protected, at least for some time, against reinfection. But of course, we are fighting that people could have the boosters. And we are very worried that for the next year, people are not very worried about that. People are not very aware of the necessity of to get this vaccine-induced immunity to reinforce their capability to fight the virus.
So Anton has a question. I mean, this is actually related to the points you're having out. So what are the most important lessons that you think you've learned from the pandemic? And obviously, what are we going to do better in the next year?
Well, let's try to be objective. Communication and sharing of information between scientists and from scientists to the society are very important, totally fundamentally important. Funding, continued funding is key to fight new diseases. The monkeypox outbreak in Brazil is being very well monitored because we have this funding that comes from the COVID-19 pandemic. This is very important. And another thing that I believe that Brazilians have learned is that we have to work in networks. Networks are very important to fight diseases and public health issues in a country of the size of Brazil. I think that we have learned this a lot. I think that international collaboration have developed a lot in our country during these last 2 years. I think that these are the most important lessons that we have learned. And a fifth lesson that I believe that we are prone to put in place right now is that we have to be prepared for the next pandemic, and that starts with the surveillance of animal reservoirs. We have this effort that is a broader network of our network, which is called the Prevent Alliance in Brazil. We have almost the same laboratories are also working with the surveillance using metagenomics and directed detection for new viruses that could have a potential to be a new zoonotic viruses in both mammalians, insects, mosquitoes, birds, and all that we could catch here in Brazil. This is not only important to prevent new pandemics, but we are learning a lot about the viral diseases that could happen in our endangered species. It's been very, very fruitful, this effort.
So around here, people are less likely to come in and test, or they home test. So then we don't necessarily know if they're positive or negative. What's going on as far as testing in Brazil? And obviously that will affect molecular surveillance. So what are your thoughts about how to improve on those things? Because obviously government funding for testing is also dropping across the world.
Yeah. People are testing at home, and even at the hospitals and clinics, people are being tested by rapid tests using antigens mostly. The thing is that it was a challenge over the last few weeks to do genomic surveillance. What we are doing is to look at the numbers and we are in close contact with the municipalities and the health authorities. And every time that they have a positive antigen test, we ask them to share with us the liquid that is used for the testing. We have tested in the past. It works for both PCR and for preparation of the genomic libraries for sequencing. And that's the material that we are using right now, because PCR was almost abundant in Brazil. People are all the time testing using home testing. So for genomic surveillance, of course, that's not very good, but we are circumventing this challenging using what we could use, and the results are quite good, I could tell you.
Okay, exciting. So Dr. Menezes has another question. Was your group able to advise the government in real time with the surveillance, and then in the past, and then also what are you doing right now to advise the government?
Well, we tried. At the very beginning, the relationship was not very good. Actually, we were highly connected to the channels in the government, because our group was within the Ministry of Science and Technology, but sometimes the Ministry of Health was not very prone to receive, specifically not the very good news that sometimes we brought to light. But during 2021, since they were really needing this information, we started to have a very good relationship in terms of communication. And every time that we found, and I could tell you that sometimes we found more than one new lineage in 1 week, or in a period of 2 weeks here in Brazil. Every time that we found that some lineage could have new mutations and substitutions, specifically at spike or other genes that could be a problem, we share this information in real time with them. And by WhatsApp and other sort of communication, we have the contacts to do this directly. It was managed to be the most urgent as could be, and the relationship evolved into something very good over the year of 2021. But at the very beginning, and I would say during the beginning of the gamma crisis, it was not that good. The relationship was not the way it should be.
Okay. Well, we're almost at the end of our time. So do you have any final points for our audience? I think this has been a great discussion. And like I said, we would love to have you to have a discussion in person. But do you have a final point to have our audience, since we're right at 10 o'clock and we have to let our audience go?
Yeah, I'll try to be quick. There are only two questions that I'm seeing that are in the Q&A panel from Eva and from Ana Beltrami. One is whether the COVID booster shot could be similar to flu shots. I believe that these will be the situation, at least for the next, let's say, 10 or 15 years, until until we find that this virus maybe could be vanished, like happened with SARS-CoV, but I do not feel that this virus will be eradicated, I would say, because it is in other animal hosts, like you have saw in the United States with the white-tailed deers, and maybe in Brazil we have found this also in other animals, that especially wildlife that is being infected over time with the virus. So this will come back to us. I believe that vaccines against COVID-19 will be part of our regular vaccination schedules. That's my feeling. The other question is about what about other viruses like Zika? What's network is able to continue to monitor the Zika or dengue? Well, Zika, and especially dengue. Dengue is one of the worst problems in terms of public health in Brazil, and we are doing a lot of genomic surveillance. The last year was nasty. In 2020, we had, I would say, the first great outbreak of dengue in the southernmost part of Brazil. So dengue is here to stay. I believe that's terrible, and the rest of the country has suffered a lot. This is one of our priority targets. Fortunately, Zika does happen from time to time, but it's not so important as dengue. But the second one among other viruses in Brazil that worries us is chikungunya. Chikungunya is everywhere. Chikungunya is here, even in the southern part of Brazil, even during the winter. So this is both dengue and chikungunya are priority stuff for us. And I believe that this will be even worse maybe in the years to come.
Okay, we're 2 minutes after. I think, thank you for the robust discussion, the informative talk, and we look forward to discussing more with you in the future. Thank you so much for taking the time, and for the audience being engaged, asking, good questions, and paying attention to this very, very important topic. So we're delighted to be a part of this global conversation series. So thank you all for attending.